Hi, I'm Dr. Bryce Staker with Olympia Chiropractic and Physical Therapy. I'm going to talk about sciatica. Sciatica is a condition that we see all the time here as chiropractors. It's a very common condition that we treat on a regular basis, almost on a daily basis. And so, what happens with sciatica is typically there's some kind of inflammation affecting one of the nerve roots that, as it leaves the spine, before it joins up with the rest of the nerve roots to create the sciatic nerve that goes down the leg. So most patients come in, they have some amount of back pain, but they almost always have along with that some kind of pain down the leg. Sometimes they've got pins and needles sensation or some burning sensation, sometimes on the bottom of the foot, sometimes it's not. And what happens there is that there's some kind of inflammation on that nerve root, typically from the posterior aspect of the joint. The posterior aspect of the joint gets irritated due to some sort of lack of normal mobility, and then it gets inflamed. As that inflammation grows, it swells with pressure on the nerve root. Most people think that sciatica could come from like a disc bulge or a disc herniation. The space the nerve root has to go through is quite large, and so typically a disc bulge or a disc herniation it really isn't large enough to put enough pressure on the nerve root for that to be the main cause of sciatica. Another thing that we know that gives us indication of when it's the joint that's part of the involvement and less like a disc involvement is that the posterior fibers of this nerve root are all mostly sensory. And what that means is if there's inflammation on that nerve root and your symptoms are mostly pain or numbness and tingling, it's got to be the nerve side of the nerve it's affected. It's got to be the back part, because if it's the front part of the nerve root are all motor sense or more motor fibers. And so if that part's affected, there's pressure on the front part, then somebody's got like things like foot drop. You pick up your leg and you can't pick up your toe. And so what we do as chiropractors when we have a sciatica case, the first thing is we want to improve the stability, the mobility of the joints, as that has a lot to do with why that joint's irritated and inflamed and putting pressure on that nerve root. So that's where adjusting comes into play. We want to improve the stability and mobility of the joint by adjusting it to make sure that inflammation comes down and the general pain and numbness and tingling goes away. The next thing we have to do is improve strength in that area, because usually why that joint's susceptible to having a dysfunction in it is a lot to do with a lot of motor weakness or previous injuries. So we have to improve the strength there to make sure that as we're getting the joint movement improved, it doesn't just come right back because we've got a weak area that's moving better. If you're having a problem with sciatica, having a problem with back pain, and you're looking for answers, maybe you're somebody that thinks it'll go away, we're a great place to come in and have a chat, to sit down and have the consultation, determine if there's something going wrong and what is it, and be able to see if there's something we can do to help you out. So if that's you and you're looking for answers for that, give us a call. We're happy to help.